What is Ziehl-Neelsen staining for TB sputum smears? Imagine trying to find tiny bacteria hidden inside a sample of mucus from the lungs. That's where Ziehl-Neelsen staining comes into play. It is a special technique used by scientists and doctors to spot the bacteria that cause tuberculosis in sputum samples. Tuberculosis bacteria are called Mycobacterium tuberculosis. These bacteria have a unique feature. Their cell walls contain a lot of waxy, fatty substances called mycolic acids. This makes them resistant to many common stains, so they need a special method to be seen under a microscope. The process begins with preparing a smear of the sputum on a glass slide. Then, a red dye called carbolfuchsin is applied. To help the dye penetrate the waxy cell walls of the bacteria, the slide is gently heated. This heating step is crucial because it helps the dye get inside the bacteria and stick to them. After staining, the slide is washed with an acid alcohol solution. This step is called decolorization. Most bacteria lose the red dye during this process, but the Mycobacterium tuberculosis bacteria hold onto the dye because of their waxy walls. Next, a blue dye called methylene blue is applied as a counterstain. This stains everything that lost the red dye blue. As a result, the TB bacteria stand out clearly as bright red rods against a blue background under the microscope. This contrast makes it easier for laboratory technicians to identify the bacteria directly in the sputum sample. Why is this method important? Because it is simple, quick, and cost-effective. It allows health workers, especially in areas with limited resources, to diagnose active tuberculosis infections. Detecting these bacteria in sputum helps confirm if someone has pulmonary tuberculosis, which is the most common form of the disease. It also helps in assessing how infectious a person might be and monitoring how well treatment is working. While newer tests like molecular diagnostics and fluorescence microscopy can sometimes detect TB more sensitively and faster, Ziehl-Neelsen staining remains a widely used and trusted method. It is considered the gold standard for routine sputum smear microscopy in many countries with high TB burdens. This technique provides a direct visual confirmation of the bacteria, which is crucial for diagnosis and public health efforts. In summary, Ziehl-Neelsen staining is a specialized way to highlight Mycobacterium tuberculosis in sputum samples by exploiting the bacteria's unique cell wall. It involves staining with a red dye, heating, washing with acid, and then counterstaining with blue. The result is a simple yet powerful tool that helps doctors identify TB bacteria under the microscope, guiding treatment decisions, and helping control the spread of tuberculosis. Always remember, if you or someone you know is being tested for TB, consult healthcare professionals for accurate diagnosis and personalized advice.